Cardiopulmonary resuscitation (CPR) is a life-saving technique used in emergencies where someone's breathing or heartbeat has stopped. It involves chest compressions and rescue breath in the ratio 30:2 to keep oxygenated blood flowing to body's vital organs. Proper training in CPR is crucial as it can significantly increase the chances of survival in cardiac arrest situations. Indications of CPR: respiratory arrest. Respiratory arrest, which may result from drowning, stroke, foreign body, airway obstruction, smoke inhalation, or drug overdose, electrocution, suffocation, myocardial infarction, injury from lightning, and coma of any cause leading to airway obstruction, and then cardiac arrest. Let's check articles of CPR. First one is arrest board or backboard or flat surface. The arrest board, also known as backboard, is used in CPR to provide a firm surface for patient's back, ensuring proper support and alignment during chest compressions. It helps maintain the spine in a neutral position, reducing the risk of further injury while performing CPR. Next is oral airway. During CPR, oral airways are sometimes used to help maintain an open airway. They are inserted into the mouth to prevent the tongue from blocking the upper airway, facilitating effective ventilation with rescue breaths. However, their use depends upon the situation and level of training of person administering CPR. It is crucial to be properly trained to use oral airways to avoid potential complications. Next is a piece of lint or oral barrier device or mask and an ambu bag. During CPR, an oral barrier device like a face shield or pocket mask is often used when administering rescue breaths. This device acts as a barrier between the rescuer and the person receiving CPR, preventing direct contact and reducing risk of infection transmission. An ambu bag is a handheld device used to provide positive pressure ventilation to a person who is not breathing or not breathing adequately. It is commonly used in CPR situations to deliver air into the lungs. Oral barrier device and ambu bag are essential components in ensuring effective and safe CPR procedures. Steps in CPR. Checking for responsiveness before starting CPR is crucial because if the person is responsive, they may not need CPR, and providing it unnecessarily could potentially cause harm. Additionally, assessing responsiveness helps to determine the appropriate course of action and ensures that life-saving interventions are targeted to those who truly need them. How to check responsiveness of a patient? Tap or gently shake the patient and shout, "Are you okay?" If the patient is not responding, move to the next step. Check for breathing by keeping your cheek against victim's nose and look at the chest for rise and fall. Simultaneously listen and feel for exhaled breath against your cheek. Breathing checking is very important because CPR should not be administered to a patient with spontaneous respiration. It will cause injury. If the patient is breathing, put the patient in recovery position. This is the recovery position, and this position helps keep the airway clear and facilitate breathing. If any doubt for breathing or consciousness, start CPR and call for emergency help. If not breathing, position arrest board underneath victim's chest. When arrest board is not available, place victim on a firm flat surface. This provides a firm surface allowing for compression of heart. And then open victim's airway using head tilt chin lift maneuver or jaw thrust maneuver. In head tilt chin lift maneuver, place one hander on victim's forehead and apply firm backward pressure with the palm to tilt the head back. Then place the fingers of other hand under the bony part of lower jaw near the chin and lift up to bring the jaw forward. And in jaw thrust maneuver, grasp the ankles of patient's lower jaw and lift with both hands, one on each side, displacing mandible forward. Jaw thrust maneuver is the safest method for opening airway in presence of suspected neck injury. After that, place an airway if available to keep the airway patent. Then, occlude nostrils with thumb and index finger of the hand on forehead and then form a seal over patient's mouth using either your mouth or appropriate respiratory arrest device, ambo bag or mask, something like that, and give 2 full breaths, approximately 0.5 to 2 seconds, allowing the time for both inspiration and expiration. Why we are occluding the nostrils and form a seal over patient's mouth? To prevent air leakage and provide full inflation of lungs. Let's look at how to position hands and fingers for CPR. Using index finger of the hand next to the patient leg, locate the lower rib margin and move the fingers up where the ribs connected to the sternum. Place the middle finger of this hand on the notch and index finger next to it. Place the heel of the opposite hand next to the index finger on the sternum. Remove the hand over the notch and place it over the hand on sternum. Extend or interlace the fingers, which do not allow the fingers to touch the chest. The arm should be kept straight directly over the hands on sternum and lock elbows. After proper positioning, compress an adult chest 1.5 to 2 inches at the rate of approximately 100 per minute. Release the external chest compression completely and allow the chest to return to its normal position after each compression. The time allowed to release should be equal to the time required for compression. Do not try to lift the hands off the chest because removing hands from chest will result in more time required to relocate the exact point of compression. Do 30 compression and then perform 2 ventilations. That means the chest compression and ventilation ratio must be 30:2. While resuscitation proceeds, simultaneous efforts must be made to obtain definitive care. That means defibrillation, pharmacotherapy for dysarrhythmias or acid-base disturbances, and ongoing monitoring and skilled care. Try to shift the patient to an intensive care unit. When to stop CPR? In case of return of spontaneous circulation, stop CPR. If any medical team has arrived, then stop CPR and hand over the patient to the medical team. And obviously in case of death,